So hello everyone, thank you for joining us today for our information session on NCUIH opportunities for UIO IPC champions, professional development scholarships, and fellowships. I'm Sophie Chishti and I'm a public health associate at NCUIH. Next slide, please. So welcome again, we are glad you could all make it today. Next slide, please. If you can, please turn on your video and mute yourself when you are not speaking. Please also enter your name and organization in the chat. Next slide. So for today, we'll provide you with some background on NCUIH and Project Firstline. We'll discuss opportunities for champions, professional development, and fellows, and we'll end with an open floor for questions. Next slide, please. So a little bit about NCUIH. The National Council of Urban Indian Health, otherwise known as NCUIH, is a nonprofit dedicated to high quality, accessible, and culturally competent public health for American Indians and Alaska Natives in urban areas. NCUIH is the only national representative of the 41 urban Indian organizations, or UIOs, across the country. Next slide. And Project Firstline is a national collaborative led by the CDC to provide infection control training and education to frontline workers. And NCUIH is proud to partner with Project Firstline as part of our cooperative agreement. The contents of today's session do not represent the policies of the CDC or HHS and should not be considered as endorsed by the federal government. Next slide, please. So here you can see some more information about Project Firstline, which is the CDC's National Training Collaborative, created to bring up-to-date training to frontline healthcare workers, not only during the COVID-19 pandemic, but also during emerging and re-emerging disease threats. The goal of Project Firstline is to provide foundational and practical knowledge about infection prevention and control practices and guidelines to frontline healthcare workers and the public health workforce. Next slide, please. So as a part of a cooperative agreement and as part of the COVID-19 response that has funded Project Firstline, NCUIH is able to provide sub-award opportunities to urban Indian organizations and staff members, as well as graduate students, to participate in infection control trainings and enhancing current practices and guidelines. UIOs who are selected as champion sites will receive $104,000 from a competitive application, and professional development scholars who are staff members within UIOs can receive up to $1,100 for programs that enhance their IPC capacity. Fellows can receive up to $10,000 to support UIOs and NCUIH staff in implementing training initiatives. Next slide, please. So now to get a brief snapshot of what some UIOs have done during their participation as champion sites, I'll play a brief video. So last year we had 5 UIO champion sites from 2020 to 2021, and these included Native American Connections, Bakersfield American Indian Health Project, Fresno American Indian Health Project, Denver Indian Health and Family Services, and the Urban Indian Center of Salt Lake. So in this video, we'll see some folks from the Bakersfield, Fresno, and Denver locations.
Right now, I'd like to introduce you to one of our lead patient transporters. His name is Giancarlo. Giancarlo's been very successful in helping us maintain our standards and cleanliness and in compliance with Project Firstline and their expectations.
We also have a log that we've been using to make sure that we track how often we are cleaning the steering wheel, the knobs on the radio, the dashboard, the visors, the interior part of the door, and the exterior as well. So we do want to thank Project Firstline for bringing awareness and helping us stay clean and make sure that everyone is safe.
At Fresno American Indian Health Project, we'd like to do more with universal precautions and work to connect our health services and safety practices outside of our 4 walls with the community that we serve. We used questioning prompts. We provided a space for reflection. We used age-appropriate graphics. Community education and engagement was an important part of our infection prevention and control program. Thank you.
All right, now we could go to the next slide. So now we're going to discuss the Champion Awards for which sites are selected. The selected UIOs will be referred to as Urban Indian Organization Infection Prevention and Control Systems Champions, or UIO IPC System Champions in short. Next slide, please. So who are UIO IPC Systems Champions? These are urban Indian organizations, or UIOs, who are selected from one of the 4 service areas: ambulatory, limited ambulatory, outreach and referral, and residential treatment centers. These sites have agreed to participate in the training initiative to implement or enhance their infection control trainings, identify gaps in their infection control programs, and work with other UIOs to support each other in enhancing their IPC programs, as well as provide feedback to the resources developed within the Project Firstline initiative. NCUIH is recruiting UIOs to become IPC Systems Champions who will work on initiatives related to training and development with Project Firstline at NCUIH. Champions will be able to tailor learning opportunities and activities specifically to Indian country and share expertise in adapting IPC guidelines to combat the current COVID-19 pandemic, as well as emerging and re-emerging disease threats. These activities will use a model of 4 key principles of learning: involvement, experience-based, problem-centered, and immediate relevance. Next slide, please. So the goal of this opportunity is to identify training needs, implement systemic IPC changes to create a culture of safety, and create flexible and responsive organizations to address ongoing needs in the wake of emerging and re-emerging diseases and the pandemic. And this opportunity is ongoing, but we would like to receive applications by August 29th. And here you can see some of the key points about this opportunity. So there are up to 5 competitive awards available, which offer $104,000 per UIO. Champions will evaluate, adopt, and adapt CDC training content on infection risk recognition in healthcare. Champions will equip trainers with knowledge on infection control. Champions will participate in training webinars, podcasts, and communities of learning like Project ECHO, which stands for Extension for Community Healthcare Outcomes. And champions can share professional development opportunities with staff, which we'll discuss further later in today's presentation. And finally, they can also develop and share resources. Next slide, please. So some of the benefits of being a champion site include connecting with CDC subject matter experts to problem solve infection control training challenges at UIOs, equipping key trainers with up-to-date knowledge on infection control and encouraging their contribution to the development of additional training resources, obtaining funding to support IPC training, working with NCUIH fellow and technical assistant staff to enhance IPC training programs, and obtaining access to other training opportunities with 75 national partners, such as the AMA, ANA, AAP, and many more. Next slide, please. So in order to apply for this opportunity, there are 5 parts to the online application package, and we're going to discuss each of these components further in a few slides. And these are pretty standard. If there are issues submitting the application online, please reach out to the IPC team at NCUIH, and you can get a copy of the forms to complete manually and submit to ipc@ncuih.org. And you can find that email in the chat as well. Next slide, please. So on this slide, you'll see some of the specific activities that champions will do, including participating in monthly calls, which are short 15-minute phone calls and not super time consuming, designating staff members to test and evaluate trainings, and this staff member can change, so this task can be rotated amongst multiple designated members, submitting agreements, reports, and evaluation components, and these agreements are contracts for the awards, and the reports are pretty simple and document the site's progress on their proposed training plans, supporting information gathering, developing trainings, and participating in trainings and activities like Project ECHO, which is a form of a community of learning where subject matter experts from the CDC and within the Project Firstline Collaborative, providers, and other healthcare workers all come together. proposing training plans on IPC, and finally, developing and implementing IPC training plans. Next slide, please. So here you can see some of the core requirements for champions. So sites will be expected to convene or continue a multidisciplinary infection prevention control or IPC committee. They'll also conduct an assessment of IPC practices. A tool for this will be provided. And they'll provide project videos, which are short clips on their progress that are similar to what we just viewed with the other champions, as well as a few more tasks. And some of these would be established after funding. Next slide, please. In order to qualify as a champion, your organization must be one of the 41 UIOs listed as active members on our website and be currently funded by the Indian Health Service under Title V, and you must submit a completed application package. Again, if you have challenges submitting an electronic application, we do offer a concierge service to walk you through the process, and we will go through this towards the end of our presentation today. Next slide, please. So for the selection criteria, up to 5 sites will be awarded, and you must submit a completed package. If you have any issues with submitting this application package, again, you can contact our team. So criteria for selection also includes focusing on the impact of the proposed IPC training plan, your willingness to participate, and your commitment to complete the required activities. Preference will be given to UIOs who represent each of the 4 primary program types, which are full ambulatory, limited ambulatory, outreach and referral, and treatment centers. Next slide, please. So now we're going to walk through the actual application. In this first part, you can see that the application asks for your UIO name, requested funding, UIO type, total UIO staff and clinical staff, and number of patient visits. We'll also need information for administrative contact at your UIO, including their name, title, mailing address, phone number, email, and payment information. Next slide, please. So next, you'll be asked to describe your assigned project director, who will serve as the main point of contact for these activities. Specifically, please provide their name, title, department or division, mailing address, phone number, and email, and we'll also ask for an alternate point of contact. Next slide. And next, you'll be asked to provide a project narrative. This is no more than 5 pages. This should include your statement of need, proposed impact, proposed IPC training, evaluation plan, and sustainability plan. Next slide. Next, you'll be asked to submit a project work plan with a template that's provided in the application. So this work plan will organize your proposed work into clear goals with corresponding activities, timelines, expected outcomes, data sources, and evaluation methods. You'll have to list who is responsible for a particular goal and any comments that you deem necessary. And your data sources can be tied into how you document your training or receive feedback on learning uptake. Next slide, please. Next, you'll be asked to provide a proposed budget, including amounts and expense descriptions for wages and salaries, benefits, contractual and consultant costs, and more. This can be general, but your total should consist of the grant amount. The Project Firstline scope is narrow and activities should focus on training. And materials purchased, such as PPE, should be used for demonstrations or training purposes. Next slide, please. Finally, you'll have to provide a signature acknowledging that you have read the requirements for this opportunity and authorizing your submission of this application. Again, if you have any questions about this application, you can contact Diana Pejun or email ipc@ncui.org, and you'll see these emails provided in the chat. Next slide, please. And just to recap, the deadline to apply is August 29th, 2022. If you need additional time, then please do let us know. And please apply early, as the signatory processes can take time. And again, we also offer one-on-one concierge services through our team, so we can assist you with the application process if you contact us at ipc@ncui.org. Next slide, please. And here's the link to the application and contact information for our team, and we'll share this in the chat as well. You can also scan the QR code on the right to access the application. And with that, I'm going to pass it to my colleague, Alyssa.
Great, thank you, Sophie, for walking us through the Champions application. Next slide, please. So hello, everyone. My name is Alyssa, and I'm a descendant of the Fort Peck, Assiniboine, and Sioux tribes. I am also a public health associate at NCUIH, and today I'm going to walk through the professional development scholarship opportunities available at NCUIH. Next slide, please. So what is the Professional Development Scholarship? The Professional Development Scholarship provides opportunities for frontline staff to access conferences, trainings, and even IPC certifications. Interested staff members can also submit a request for approval of an activity around infection control that they would like to attend or complete for learning purposes. These opportunities are limited to 2 staff members per UIO and will help UIOs to enhance their IPC practices and programs. Next slide, please. So the aim of this opportunity is for UIOs to have at least 1 staff member certified and or trained in IPC or related areas, and to cover the costs of training, conferences, prep courses, certification exams, and other professional meetings. This scholarship would cover up to $1,100 per person. Next slide, please. So now we will look at a few objectives of the scholarship program, including to obtain representation from 4 key types of UIOs, to engage healthcare workers through trainings and certifications related to IPC quality improvement, to track UIO staff participation, and to provide relevant training and certification opportunities in various relevant fields. Next slide, please. Now we will look at some of the core requirements around this opportunity. These can include having a priority on IPC specific training or certification options and to improve internal processes. Selected participants will also have to evaluate this opportunity and identify how this opportunity has enhanced IPC measures at their site, as well as how it has enhanced their own professional development. Again, to note that these scholarships can cover up to $1,100 per individual, but they do not cover fees for college or university coursework or degrees. Next slide, please. So what we have here is not an exhaustive list of everything on IPC, but there are a few examples of opportunities which scholars may access, this will be provided to you in the chat to explore. You may also identify other opportunities that are outside of this list, and you can submit these activities for approval. Next slide, please. So you don't want to miss on this opportunity. There are various benefits around it, including certification related to IPC, enhanced IPC skill sets, and sustained organizational quality improvement initiatives. Next slide, please. So what do you need to be eligible for this? So to qualify for this opportunity, you must be an employee at one of the 41 UIOs currently funded by the IHS under Title V and listed on our website. And you also must complete the application package. Next slide, please. So now we will take a look at the application package and the process. This here is a checklist of the application process, including watching the recording of this session in case you need to revisit any of the steps, which will be available on NCUI's website. You will also complete the online application package and submit the application. It's important to note that this application must be completed by July 31st this year. So we invite you to visit the website along with the application form for more information. This will be provided to you in the chat. Next slide, please. Criteria for selecting scholars will include only reviewing complete applications. So you have to be sure to submit a complete application, and distributing up to 41 scholarships with no more than 2 staff per UIO and applicants who meet the eligibility requirements. It's important to note that scholarships are not transferable, and preference will be given to opportunities that are geared towards enhancing IPC. Next slide, please. So now we will walk through the application process just as Sophie did for the Champions application. You can see that the first part here is focused on the UIO staff member that's applying for the opportunity. It will ask about the staff member's name, title, role or responsibility, certification or credential, tribal affiliation, address, and email. Next slide, please. Next, we will ask that applicants describe their daily duties and responsibilities in their IPC roles, as well as what they hope to achieve from this opportunity and why these opportunities are relevant to their daily work. Next slide, please. The next part of the application will focus on the UIO. We will ask for the UIO name, address, phone number, the type of UIO, and information on the event or certification. Next slide, please. On this fourth part, applicants will have to complete a proposed budget to describe the expenses and the funding requested. Next slide, please. And finally, applicants will sign to acknowledge that they understand the application requirements. The application link for this opportunity will be shared again in the chat. Next slide, please. So just to look at key dates, the application and the funds must be dispersed by July 31st, 2022, and applicants will be notified within a week. Reimbursements will involve completing all post-event requirements, signing a reimbursement form with accompanying receipts from the event, and then processing reimbursement checks within 3 weeks of receipt. The reason for the very fast turnaround is that the closing of year one grant activities is on July 31st. So if you are interested in this opportunity, it is good to apply as soon as possible. However, I do want to mention that you can also seek this opportunity through funding from your UIO if they are selected as UIO systems champions. Next slide, please. So once again, here is the link for the application. Please feel free to contact our team at ipc@ncui.org if you have any questions at any point during the application process, or if you need any assistance, and we can set up a time to meet. You can also visit our website for more information. Next slide, please. So now we will transition to talking about the fellowship opportunities at NCUI. Next slide, please. I'm very pleased to introduce our current fellow, Zoe Harris, who has been with us since March and has been doing incredible work with Project Firstline. Zoe Harris is a community health science PhD student at the UIC School of Public Health. Zoe is a citizen of the Mashpee Wampanoag tribe and has worked with her tribe as well as urban native populations on topics related to indigenous wellness systems. Zoe is also a Jamaican citizen and has family roots in Selma, Alabama. Therefore, she strives to educate people on the experience of Afro-Indigenous people to address the lateral oppression that exists in these communities. She has also worked on projects related to suicide prevention, social determinants of health, and racism as a public health issue. I will now hand the floor over to our fellow Zoe to talk to you about the fellowship program.
Thanks, Alyssa. Next slide, please. So as Alyssa said, NCUI is currently recruiting American Indian Alaska Native graduate students who are currently enrolled or will be enrolled in the 2022 fall semester and or the 2023 spring semester to become UIO IPC Systems Fellows who will be supporting the urban Indian organizations who have been selected as champions for Project Firstline. Next slide, please. As a fellow working with the NCUI Project Firstline team, I'm really pleased to be here today to talk to you about this program. This fellowship is funded through an award provided by the National Center for Emerging and Zoonotic Infectious Diseases within the CDC and is intended to offer hands-on experience in building capacity and providing technical assistance in urban native public health with the emphasis on infection prevention and control within the scope of Project Firstline. Next slide, please. These are some of the key points to note about the fellowship. So there will be 2 awards awarded. The recipients will receive up to $10,000 per award, and the duration of the fellowship ranges from September 2022 to September 2023. Submissions are now open, and they will remain open until September 29th, 2022. And this application information session recording will be posted on ncui.org, so it can be referred to later. Next slide, please. Recipients of this fellowship should be prepared to commit between 15 to 20 hours per week. This is a remote position, so you should have a personal computer, a telephone, high-speed internet access, and a designated office space, as well as anything else you need to maintain a professional virtual office setting. Next slide, please. These are some of the main activities during the fellowship, and it includes assisting the NCUI staff and subject matter experts in the following activities. So development of culturally appropriate activities, development and promotion of things like webinars, podcasts, and Project Echo series, as well as liaising with the project evaluation team to aggregate evaluation and survey responses from our UIO participants. Next slide, please. These are just some more activities that range from supporting champions to providing feedback on the overall experience, as well as participating in Project Firstline events and NCUI's annual conference. We also support with any other tasks that are assigned within the scope of the project, and as well as supporting the fellow's own college and university standards. Next slide, please. In order to be eligible for this opportunity, you need to be enrolled in the 21 to 2022 or 2022 to 2023 academic year as a graduate student at the time of the application. You also must be a member or citizen or descendant of a federally recognized tribe or Alaska Native village. Undergraduate applicants, so people who are going into graduate school, must have a minimum of a 3.0 GPA on a 4.0 scale, and graduate applicants must have a minimum of a 3.25. In addition, you must intend to serve American Indian Alaska Native people as professional through your chosen discipline. And then finally, make sure that you submit everything in the complete application package, which we will be going over shortly. Next slide, please. So, participating in this application session is a great first step. And again, this recording will be posted at www.ncui.org for you to refer to later. And these are all the different pieces of the application. So the first part includes personal information, school information, your tribal membership or affiliation, and then 2 short answer questions. You'll also ask to be provided to provide a resume, a writing sample, and references, specifically with letters. And then finally, there's an acknowledgement. Just as some tips as a past fellow, I would say just to be honest about why you want to take place in this fellowship. I personally don't have an infection control background, but I knew what transferable skills I had. Kind of going off of that, I would say think about the skills that you want to build on during this fellowship and also what you have to offer to NCUI. As it relates to the references, I would say get your letters as soon as you possibly can. I'm sure that the people that you know in your life are very busy, so make sure that you have enough time to get all of those letters in. And then finally, if you can have someone review your work before submitting, it's a great way to make sure that you have all the different pieces of the package together before you ultimately submit it. Next slide, please. These are just some snapshots of the application form to provide a visual. You can see that the first part is to provide personal information, so name, tribe, mailing address, etc. Next slide, please. Part 1 also includes spaces to answer and fill out the short answer questions, which are limited to 500 words. You'll also attach your CV or your resume and a writing sample. Next slide, please. Lastly, you'll provide contact information for your referees along with 3 letters of recommendations and sign the acknowledgement. So as you can note here, you upload the recommendations on your own. Next slide, please. These are just some of the following criteria that will be used to select candidates. So overall impact on the proposed project and a project plan, the reasonableness of the project scope, feasibility of it, and then also relevance to Project Firstline, a willingness to participate exemplified in the application, a commitment to completing the core set of required activities, and then ultimately we will pick the top 2 applicants, but again, incomplete applications will not be reviewed. Next slide, please. The applications are now open on a rolling basis, so it will be up until August 29th, 2022, and we're really excited to welcome the new fellows into the program. Of course, you can always contact ipc@ncui.org for questions about this application. Next slide, please. So again, don't hesitate to contact us if you have any questions around the application process or the fellowship program. We're also happy to set up a time to review your application and answer any questions. So we have provided these links in the chat for you, and you can also use the QR code on the screen to take you directly to the application. Next slide, please. So before transitioning to our next segment, I'll just cover a few FAQs. So first, how many Project Firstline fellows will there be? There'll be 2 fellows selected, and funding will vary depending on the preferred duration identified by each fellow identified in their application. 2, I'm not a public health student. Can I still apply? Yes, students from any field are welcome to apply, whether that's nursing, medicine, behavioral health, as long as the student's work relates back to the areas of one of the following. So infection prevention and control, mental health, behavioral health communication, improving health processes, improving health quality, or any related area. My application is late. Can I still apply? No, all applications, including letters of recommendation, must be submitted before the deadline unless there are extenuating circumstances, in which case, please contact ipc@ncui.org to set up a meeting to discuss this. When will I know if I'm a finalist and when will my interview occur? Finalists will be notified within 2 weeks of the receipt of the application, and then they will be invited to participate in an interview with NCUIH staff. And then the final question, will interviews be in person or online? All interviews will be taking place online. And we will share in the chat the application links around for the various opportunities and programs shared today. Next slide, please. And now I will give it back to Alyssa.
Great, thank you, Zoe, for being here today with us to talk about the fellowship program. So as Zoe mentioned, we'll now share in the chat all 3 of the opportunities that were shared with you all today, especially for those who might be interested in all 3 of them. And so those will be provided to you. Next slide, please. And so we understand that there was a lot of information given today and that this whole process can seem overwhelming. So we're very pleased to be able to offer application concierge service if you may need any assistance during the application process. For any of these opportunities that were shared, please contact us at ipc@ncui.org to schedule an appointment. One of our staff can walk you through the application process at any point, as I mentioned. This email will be shared in the chat box. So I will now transition to Sophie and we'll open up the floor for questions and discussion.
Thank you, Alyssa. Go to the next slide. Perfect. So we'll now open up the floor, like we said, for discussion and questions. So please feel free to unmute yourself. You can come off camera or ask in the chat your questions.
I saw that there was a question in the chat asking if this is a yearly opportunity.
I can take that question for Jessica. Yes, we will be offering the fellowship opportunity for each year that the grant is renewed. We found that it was very beneficial to have feedback from our fellows and to have them participate in the program. Jessica, do you have additional questions on this? We can go into the next question. Sophie.
Sure. So we see a question in the chat asking, Zoe, what was your favorite part about being a fellow?
Good question. I think my favorite part was probably being able to take part in the NCUIH conference. It was really nice to be able to present on the work that IPC had been doing, but also seeing all the other great work that NCUIH does and the UIOs do. And also I formerly worked for a UIO, so I was able to see some of the people that I formerly worked with. So it was really great to kind of continue those connections. So that was my favorite part.
Thanks for sharing that, Zoe. I see another question in the chat. So what if the award application is not submitted by July 31st?
Is this for the professional development scholarship, or is this for the fellowship program? I'm assuming that July 31st would probably apply to the professional development scholarship. This is in line with the grant closeout deadline for that, under which that opportunity falls. However, organizations that have been selected as champions will be able to provide professional development scholarship opportunities to their staff. So staff members are interested, they can speak with their organization as to what this may look like. But individuals who are interested in pursuing conferences or trainings or applying for certain trainings around infection control and would like to recommend these opportunities for approval can do so before the 31st.
Dan, can I ask a follow-up question to that? So if a candidate submits their application prior to the July 31st date, but there are errors or mistakes that need to be updated, and the update or resubmission isn't until after, are they no longer eligible?
They're still eligible as long as we get the initial application before the 31st.
Okay, thank you.
I do know that we went through the champion bit very, very quickly. And I don't know if our audience has any questions about the requirements or the application process. But if in the process of submitting the applications online, if there are glitches, please feel free to connect with us and we can send you the forms where you can do the entry manually and submit through email. So that's another option that's available to you.
And you'll see again, Alyssa has just put our email in the chat, ipc@ncui.org.
I do see one participant who had connected by email. Brandon, do you have any questions regarding the fellowship? If you want to unmute yourself, if not at all, then that's fine. Okay, well, it seems like folks are pretty comfortable. I see a question from Johnny here. Can you please clarify that this is the same award that UIOs were awarded earlier this year? Yes, I can clarify that. So for year 2 Project Firstline, which focuses on COVID-19, emerging diseases and emerging disease threats, this opportunity is indeed a part of Project Firstline in its 2nd year. We have increased the amount of the award, but we have decreased the number of sites that are available to justify that increase. There are additional activities in the core requirements, so it's pretty much the same opportunity. I hope that helps, Johnny. There is nothing additional to submit for champions in our year 2. We will be reaching out to you to set up a meeting so that we can do a modification to the original agreement. So there's no new submissions required. Okay, great. So we will make a PDF of this presentation available to you by email, and we'll provide a link as to where the videos are uploaded. We'll also send to you the links to the applications so that you can share them with your staff, or if you'd like for your grants managers to review and go through the application, then they can do that. Sophie, back to you.
Thanks, Dion. Do we have any other questions? And I actually have one. If we have anyone here today who has gone through the Champions program, do you want to speak a little bit about the benefits of the experience or some of your favorite parts from the experience? You can feel free to unmute yourselves or share that in the chat, but that would be great to hear.
We have a shy group. Maybe we were really clear. Everything was understood.
Yeah, I think we do have a shy group with us, but I see folks are still logging on rather. So welcome. We are in the process of wrapping up the presentations. We did finish a little bit early. We wanted to leave ample time for any questions you had. If there are any parts that were not clear to you, please do reach out and we can schedule as a part of the concierge service, a one-on-one walk through the application process. There are 3 awards tied to Project Firstline. I think it's a great opportunity for sites to review their infection control training, especially amongst in the midst of the COVID-19 surges, with monkeypox as an emerging disease threat, and other concerns around antimicrobial resistance. So it's a great opportunity to take a look at your infection control systems and your training and just to identify any gaps and to make use of the opportunity that the CDC Project Firstline team is providing to connect with you and to provide guidance on overhauling infection control practices. So thanks for being here. I will hand back to Sophie so we can close.
I wanted to add one more thing. Even if you're not a graduate student yourself, but you know someone who is of the American Indian Alaska Native community who is a graduate student who could be interested in the fellowship, feel free to pass along this application to them so that they can seek the opportunity as well. Back to you, Sophie.
Thanks for adding that, Alyssa. If anyone does have any further questions, feel free to unmute yourselves, put them in the chat. And again, you can always email us with any questions as well. So if there are no other questions at this time, we can move on to our closing. If you want to go to the next slide. So before ending today's session, we just wanted to share a bumper of NCUI's Project Firstline podcast series. So a link to the full episode will be provided in the chat, and you can also scan the QR code on the screen to listen to the episode.
Lamar, can you play the bumper as a teaser, please?
Welcome to the National Council of Urban Indian Health podcast on infection prevention and control education topics for our frontline warriors, our healthcare team members serving American Indians and urban Indian health organizations. My name is Vicki Oldman, your host for these broadcasts. I am Diné Navajo and a resident of New Mexico. I am an independent consultant and have been working with Native communities and nationally for over 2 decades. In these broadcasts, I will be interviewing leaders, advocates, and practitioners with a focus on infection prevention control strategies in urban Indian healthcare settings. Thank you, Ashahat, for joining us.
All right, thanks for playing that, Lamar. And again, you guys can feel free to go listen to that podcast using the QR code or the link provided. I see that we have another question in the chat that I just want to highlight. So from Jessica, she asked, do they have to be enrolled or lineal descendants eligible as well? And Alyssa responded that lineal descendants are also eligible for the fellowship. And Jessica or Alyssa, I don't know if either of you want to elaborate on the question or answer, but feel free to.
I just wanted to mention, Jessica, that's a great question, but yes, descendants are eligible as well for this opportunity.
Wonderful.
Thank you.
Thanks for sharing. And does anyone else have any other questions? All right, if there are no other questions at this time, we'll go ahead and wrap up for today. Again, thank you all so much for attending. You can actually go to the next slide, please. Thank you all for being here. We really appreciate all of you taking the time to join us today. And again, you can feel free to email us with any questions. We hope to see more applicants for all of these opportunities. And we hope you all have a good rest of your day. Thank you so much.